This is a birth story episode that you do not want to miss. Welcome to the All About Pregnancy and Birth podcast. I'm Dr. Nicole Calloway Rankins, a practicing board-certified OBGYN who's had the privilege of helping hundreds of moms bring their babies into this world. I'm here to help you be knowledgeable, prepared, confident, and empowered to have a beautiful pregnancy and birth. Quick note, this podcast is for educational purposes only and is not a substitute for medical advice. Check out the full disclaimer at ncrcoaching.com/disclaimer. Now let's get to it. Hello. Welcome to another episode of the podcast. This is episode number 84, and I'm so glad that you're here with me today. So in today's episode of the podcast, I have Jennifer Abdul Rahman. Jennifer is a mother to 3 young boys, and she's also an IBCLC, that's an International Board Certified Lactation Consultant. Jennifer's birth story episode is a little different because she's actually going to share a bit about all 3 of her births. Normally on the podcast, guests focus on just one story for the birth story episode, but we really need to hear all 3 of Jennifer's births in order to get the full picture. Now, for a little teaser about her births, the first was a C-section after an unsuccessful labor induction. The second was a bit of a forced repeat cesarean birth after the practice where she went refused to let her attempt a VBAC. And then the third was an attempted VBAC, also known as a TOLAC, trial of labor after cesarean. And interestingly, all 3 of these births happened with the same practice. Now, there are so many great lessons in Jennifer's story that all mamas can learn from. Also, Jennifer is Muslim, and in addition to her birth stories, she shares some of her cultural and faith traditions surrounding birth. You are definitely going to find this episode informative and interesting. I know I learned a lot, and you will too. Now, before we get into the episode, I have a little bit of a secret to share. Within the next week, I am going to make an announcement about my signature online childbirth education class, the Birth Preparation Course. The Birth Preparation Course is exactly what you need in order to feel calm, confident, and empowered to have a beautiful birth. And if you have at all been thinking about enrolling in the course, then you don't want to miss this announcement. Follow me on Instagram at Dr. Nicole Rankins. That is the place to go if you want to hear it first. All right, so let's get into the episode with Jennifer's birth stories. So thank you so much, Jennifer, for agreeing to come onto the podcast. You have a really interesting story, and I am excited and grateful that you want to come on and share it.
Yeah, absolutely. Thank you for having me.
Yeah, so why don't we have you start off by telling us a little bit about yourself, your work, and your family?
Sure. So I'm a registered nurse. I've been a nurse for the last 10 years, and I'm married. I have 3 boys. My oldest is 8, my middle child is 6, and my youngest just turned 2 in January. So we kind of live in Pennsylvania. It's been nice, I guess, recently, like a struggle and nice that we have more family time. The kids are home. So
Yeah,
it's like every day's a little unpredictable, but today's a good day. So I'm just going to go with that.
Gotcha. I hear you. What kind of nurse are you, or do you still practice nursing?
So I started out doing long-term care and then med-surg, and I currently work as a lactation consultant. So I'm an IBCLC. I work in a hospital, and I also do private practice as well.
Okay, awesome. And we'll talk about that at the end, how people can find you in your lactation practice.
Absolutely. Thank you.
Awesome. All right. So for your story, a lot of times on the podcast, women go through one birth story, but in your case, we have to really go through all 3 in order to get the full scope of everything that happened.
Yeah, absolutely.
Yeah. So how about we start off first with talking about your first birth? I know that was an induction for pre-eclampsia that ended in cesarean. So how was that for you?
Yeah, so I was actually working at a nursing home at the time and I was not feeling well one night and I took my blood pressure and it was very, very high. And I had an appointment the next day. So I went home, I slept, I went to my appointment and it was still high. So I was about 32 weeks at that point and they immediately put me on bed rest. So I was out of work, I was doing bed rest, but even though I was a nurse, I hadn't been a nurse for very long. I didn't work OB. So I don't think I fully understood how severe preeclampsia can be. So I was on modified bed rest rather than strict bed rest. So I probably didn't do as much bed rest as I should have. But I
Oh, don't beat
needed
yourself up about that. It's hard, bed rest, we don't even know that it really does anything. So you were doing the best that you could at the time.
Yeah, absolutely. And around 37 weeks, I went in and it was like nothing was working to keep my blood pressures down. So finally at that point, they were like, we need to induce, like we need to deliver the baby. And going through all of my experiences, I found that I was one of those people who, as soon as the baby was delivered, my blood pressures came back down immediately, like purely like pregnancy related. And that was what cured the preeclampsia for me. So with my first, I was induced. It was an exceptionally long labor. I felt like I had every intervention they could throw at me to help my labor progress.
Yeah.
And
How long was the induction?
um, it was probably almost 40 hours.
Okay.
They started with some Pitocin, but because my blood pressures were high, they also put me on magnesium. So it was kind of like this game of like keeping the magnesium, at a level that it's actually going to benefit me and help my blood pressures, but then also trying to increase the Pitocin to help the contractions and help the labor progress. They tried helping to dilate my cervix, and I eventually stalled at 5 centimeters, and I was there for quite a while. Finally, when one of the doctors kind of had a conversation with me about doing a C-section, because at that point I was kind of going on almost 2 days of being in labor.
Gotcha. And how did you feel about when you got to that point?
I had a mix of emotions. I was definitely exhausted. I could barely stay awake. I was so tired. I remember when I was in the OR, I kept telling the anesthesiologist, I was like, I think I just need to sleep. I need to sleep. And he's like, it's okay. He's like, it's okay. He's like, just go to sleep. It's okay. And I was like trying to fight it so hard. But it was a mix of emotions of being tired and also disappointment that things didn't go as I had planned.
Gotcha. And what had you planned? What had you wanted for your birth?
Yeah, I mean, I definitely had wanted a natural delivery. I wanted to be able to deliver naturally and I guess kind of just have my baby how we're supposed to have babies. And that didn't quite go as planned.
Gotcha. Gotcha. Do you feel like during the process people listened to you? You were treated well? What about that aspect?
I felt like with my first, they were, very supportive, and understanding of the fact that things were not going as planned. And I do remember before I went back to the OR that things were very kind of calm. And then once I said yes to the C-section, it was like a rush. Like I don't even remember going from the delivery room to the OR. It was just everything went so fast at that point. And it was like before I knew it, the baby was out and it was like all done. And I think it was the whole experience seemed to kind of be cut short in a way, especially because my baby was then taken to the nursery. It wasn't a baby-friendly hospital at the time, so they didn't allow the babies to stay in the OR.
Oh,
So I was separated from him for almost 2 hours.
okay. Yeah, that sucks.
Yeah.
For sure, for sure. So then you got pregnant the second time, and
hmm
then there's this discussion of wanting to try for a VBAC versus having a repeat C-section. So
Yeah.
what did you decide in that situation?
So I had wanted a VBAC, and I did all of my research. I studied all the evidence. I talked to people. I did everything I felt like I could on my end to educate myself. And I knew what the risks were, but I also knew what the benefits were. And the practice that I was at, I don't think it was a policy yet to do a VBAC after a cesarean. So every doctor I talked to refused to do a VBAC. They pretty much said I had to go into labor on my own or it was a C-section. So I felt like, I guess, powerless. It was all out of my control. I pleaded for just low-dose Pitocin or just the Foley balloon to help dilate my cervix, something like just something to to start things because I was 41 weeks with my second and still only fingertip dilated and nothing was happening as far as contractions. And even at that point, nothing, they just said no. If I didn't go into labor naturally, I would have to have a C-section.
Right, right. And what area were you still in Pennsylvania at that time?
Yeah. And that was in 2013. My first was born in 2012, and then my second was, they're 18 months apart. So my second was then 2013.
Okay, okay. Let's talk about something most pregnant women aren't getting enough of, omega-3 DHA. The recommendation is over 200 milligrams a day, but less than 5% of pregnant women in the US meet that. That's one of the reasons I love Ritual's Essential Prenatal. It has 350 milligrams of vegan DHA plus other key nutrients like methylated folate and choline to support baby's neural tube development. As an OBGYN, I appreciate that Ritual goes beyond the basics. The formula is science-backed, third-party tested for heavy metals and microbes, and every ingredient is traceable. And the delayed release design, it's gentle on the stomach, something that really matters, especially if there's trouble with nausea during pregnancy. You deserve to know exactly what you're putting into your body, especially when it comes to prenatal multivitamins. And with Ritual's dedication to traceable science and sourcing, you always will. See for yourself with 25% off your first month at ritual.com/Dr. Nicole. Start Ritual or add Essential Prenatal to your subscription today. That's ritual.com/Dr. Nicole for 25% off your first month. Did you consider trying to find another practice, or were you hoping things would just that you wouldn't get to that point?
Yeah, I had considered it. Unfortunately, the insurance I had, I could only go to that hospital.
Gotcha. You're faced with what you're faced with, and you were
Yeah.
trying to make the best out of the situation that you had.
Yeah.
I mean, how did you feel during your pregnancy and like every single time somebody's saying like either it's this or a C-section?
I really felt like it was my body and I had no control over what was being done to it. And it wasn't like I didn't feel that I was taking a risk because I had done all the research and I knew what the risks and benefits were. And I had seen what was being done in other places in our country and that this was an option for a lot of women. So I think that was the part too where this was being done. And even though I'm asking for it, I was just repeatedly denied. And even when it came time for the delivery, I asked for delayed cord clamp and I asked for going in knowing I was going to have a C-section this time. I asked for the drape to be dropped so I could see my baby come out and, have the baby stay in the OR, be skin to skin, and all of those things were denied. So that was the hard part too, because I knew once again that my baby was going to be taken away for 2 hours. I wouldn't see him. And I think that was the hardest part about my first delivery because I felt so disconnected. And that's why I wanted a VBAC so bad with my second, because I felt
Right.
so disconnected from the whole experience. Like I never felt them come out. I never saw them come out. And that's hard to like cope with that afterwards when something's happening to your body, but you can't even feel or know that it's happening.
Wow. Hearing it is just really hard to hear because I can
Yeah.
imagine how difficult it was for you. Do you feel like it made it hard for you to establish that bond and that connection with your baby that you had this delay?
With my first, definitely. I hear a lot of people say they're like immediately in love with their baby. And with my first, I felt like it was a couple of weeks until I really had like a connection with him or like had like emotional feelings towards him. My second, I felt like it happened a little bit more quickly, but it was still difficult after to kind of get my mind past that disconnection.
Right, right. And then I guess what was their response with at the second time when you come to this conclusion that okay, I'm going to have this cesarean. You come to this conclusion and then you ask for things like delayed cord clamping and skin to skin. What did they say when you asked for these things?
Literally just no. It was the doctor that I spoke to that was there to do my C-section that day. He was just like, no, we don't do that. And I was kind of like taken aback because I was like, wait, what? I I've researched this and there's evidence-based research on this and I just couldn't understand. And I think a lot of it had to do with policies and procedures, which I also feel is unfortunate that we can't make room for accommodations in that way, especially when it makes such a huge impact. But I also feel like the impact that those experiences had on me, that was never discussed. I don't think anyone maybe even realized it or even discussed those things with me. So I also feel like they didn't really have the knowledge to know the impact that that was going to have.
Yeah, for sure. Man, that is just so tough. Now, at this, and was this the same hospital where you had your first?
It was, yeah.
Okay. Did you know anything about the hospital ahead of time in terms of how they, like, what kind of, I'm just curious if they had a reputation in the community
Yeah,
for
so
birth?
I mean, the hospital has a good reputation, and I think that baby friendly designation made a huge difference because at that time they were not baby friendly. But once they were, then all of these practices were implemented. So that made a huge difference.
Gotcha. So all three of you, your babies were born at the same hospital.
Yeah, my second one or my third baby I had at a different site though.
Okay.
So it was not in the same environment.
Gotcha. Gotcha. Okay. So you have the second C-section. So they won't do delayed cord clamping, skin to skin. And again, they took the baby away to the nursery?
Yeah, so it was another instance where I asked, can the baby stay in the OR at least for a little while? And they said no. And I think it was something that they didn't have the staff to support having the baby stay in the nursery. So my husband went with our son to or stay in the OR, I mean. So my husband went with our son to the nursery and then I stayed in the OR. And then they brought him back to me when I was in the recovery room. And my second C-section actually, because I had a lot of scar tissue from my first, I was in the OR for probably a good hour and 45 minutes because I could start to feel like the epidural starting to wear off and the morphine doesn't do anything. They gave me some extra morphine and I was
It's
like,
like, okay,
yeah.
yeah.
I'm like maybe a little sleepy, but I still feel the pain.
Right, right.
So it was probably a good 2 hours, maybe even longer until I saw him in the recovery room then.
And nobody said that your husband could just sit there and hold the baby, like, while in the OR. Like,
Yeah.
nobody oh
And
gosh.
and at that time, I felt like I did a lot of education and, educated myself. And I still wasn't even aware of like even asking him to, like, can he do this? That part of it was not even considered either.
Sure, sure, sure. Oh, that's really heartbreaking to
Yeah.
hear. So then you get pregnant a third time and you decided again that you wanted to try for a vaginal birth.
Yeah.
How did you come to that decision?
So I think because both of my first experiences, my first and second pregnancy, I just had that major disconnect and I just mentally could not get past that experience. And I also felt like I didn't do everything I could to try for a vaginal delivery. Like I was just always in the back of my mind, like if I had had this option, could I have delivered vaginally? And I just like couldn't let go of that question. So the third time when
But I'm sorry, I hate to, but I feel like you did everything you could. Like, what more could
yeah,
you have done?
I guess I did in the constraints of like where, what options and resources I had. I did everything I could and I advocated for myself as best that I could. And I guess I really wanted to deliver naturally and just like have that moment. And when I went to the OB for my third pregnancy, they were actually like, oh yeah, like we can do all of these interventions now. And I'm like, really? I'm like, not even like 4 years ago. This was
Right.
like I was told nothing. And now, we were able to do all of this other like everything I had asked for that second time, now it was an available option.
And this is the same group of doctors.
Yeah. Yeah.
That
Yeah.
must have annoyed the blank out of you.
It
Like,
did.
okay.
It did because I felt
Like,
like this is everything I advocated for with my second pregnancy, not even 4 years ago. And it took that long for them to kind of catch up, I guess, and get on board with this stuff. So that part of it, it was definitely frustrating. It was definitely frustrating, but I also had a little bit of hope because I felt like, okay, like even though this is late, I guess better late than never. And we did do as much as they could. And I actually, with my third at about, I think it was about 32 weeks, I got the stomach bug. I do not recommend the stomach bug while pregnant. It was the absolute worst. It lasted an entire week. I was constantly like nauseous, vomiting, getting dizzy all the time. And because some of the symptoms overlapped with preeclampsia and because of my history, I was kind of in and out of the hospital a little bit. And they had done a 24-hour urine, which showed some trace protein. And that was kind of like my worst fear, like that preeclampsia would develop and would limit my options. I was kind of labeled as like mild pre-E. So it was kind of just a game of, how long can I go until those symptoms could possibly get worse, but also given my body enough time to be able to go into labor naturally or hope that it does. So I hit 38 weeks. And at that point I decided to do an induction because I was like, I'm far enough along at this point that hopefully my body will, kind of start to kick in with the induction methods, but also the pre-E. Like for me, I felt fine. I know what pre-E feels like because I had it with my first and I did have severe symptoms. Like all the symptoms that they say you get, I had the floaters, the flash edema, the swelling,
Headaches,
the headaches,
all of
everything,
it. Okay.
everything. So I knew what that felt like. And I did not feel like that at all with my third. I actually felt really healthy. I gained way less weight with my third than I did with my other two. So it felt like a much better, healthier pregnancy. And then when I came for the induction, so we did some low dose Pitocin, they dilated my cervix with the Foley balloon. I got to about 5 centimeters and I was having contractions like every 2 minutes because of the Pitocin. And then at that point, they had broken my water and I was kind of, in that for a while. And my body just wasn't progressing again. So it kind of stalled at 5 centimeters.
Okay. But you felt like this time you actually had the opportunity.
Yeah, I felt like I had the opportunity. And I think the thing for me is that when we did decide to do a C-section again, they shut the Pitocin off and my contractions immediately went from like super strong every 2 minutes to like mild every 10 minutes.
Okay.
So that was that was like a huge clue to me that I was like, okay, like no matter what I do, my body just does not go into labor. Like it just doesn't happen. So that was kind of like validating for me that it wasn't something I did or didn't do. Like my body was just not meant to go into labor.
So this time do you feel like you felt better about the C-section decision?
I do. I felt more confident about the decision and I felt like the decision was mine. I felt like I was the one who made that decision and had control over that decision. And I always remember the one nurse I had, she was probably the only person ever throughout all three of my pregnancies who really had this conversation with me. But when I was in labor with my third and we were kind of like, on the fence of, they were trying to talk to me about a C-section and I was like not having it. And she was like, why is this so important to you? She's like, can you tell me, like, just tell me why this is so important. And I just like burst out into tears and I started telling her about my horrible experience with my first two. And she was probably the only person that ever even asked me that question. And then I just remember her going like above and beyond to do everything she possibly could. Like I was in the OR and she was yelling. She's like, where's the clear drape? Let's get the clear drape. Where is it? And they found it and no one had used it before. So it was kind of a little awkward, but we figured it out. And I was actually able to like pull the drape down. I could see him come out. I could see him, they were holding him up and I could see the cord and then they did the delayed cord clamping. So it was just a totally different experience. And she really was, instrumental in that in helping to make that the birth that I had wanted for my last two even.
Right, right. I That just must have made a huge difference in how you felt when about the whole experience.
Yeah, and I definitely felt more connected. They took him to the warmer for the 1 minute and 5 minute APGARs, and then they brought him right back to me and put him on my chest. And he was on my chest in the OR. He breastfed in the OR, and he was there for like a good 45 minutes. The one nurse was like, "Okay, we have to take him in a little bit because we're gonna put you over onto the stretcher." And she probably had to say it like 4 times. And I was like, "You're just gonna have to take him. Like, I'm not gonna like, give him up. You're just gonna have to take him." So it was a totally different experience. And I remember like he breastfed in the OR at least twice. And then when we got back to the recovery room, he breastfed. He was just on and off the whole time. Like the whole time he was breastfeeding. And I remember with my first two, because they missed that initial breastfeed in the first like hour or two, it was like they fed, but it was like 10 minutes. And then I don't even think they fed again for like 3 or 4 hours. Like it was just not the same experience at all. It was totally different in that respect as well.
So do you feel like even obviously the nurses were like saving the day for your third
Yeah.
C-section. Do you feel how were the physicians?
So when I went into the hospital, I was there for two different shifts, and I felt like the first doctor was definitely respectful, especially for me as a Muslim, like there's certain things that I prefer.
Yeah, and we'll talk about that in a second too, but
Yeah. So there's certain things that I prefer, and I felt like he was definitely respectful of that. So I actually refused magnesium with my third. They wanted to put me on it, and I said no because I knew my body and I knew that I was not experienced in preeclampsia. I knew that my blood pressures were fine, even though my average blood pressures when I'm pregnant are like kind of like considered like mildly high for pre-E. That's like normal for me. And if I take pressure meds, I'm actually highly sensitive and I drop too low. So I know what my good range is and what my bad range is, and I knew how it felt. So I actually refused the magnesium. He didn't really agree with that.
what
But I
were
was
your
like,
numbers? I'm curious. Do you know what your blood pressure was in the hospital?
yeah, so I was averaging like 130 over 80 to 140 over 90 with my third in the hospital. And they would go up a little bit when I was having contractions, but then they would come right back down. So I think just because I had that diagnosis of pre-E, they had wanted to do the magnesium, which I knew would stall my labor for sure. So I was not okay with that.
Yeah, we don't and actually we don't so much you were right. We don't we
Yeah.
don't we don't do magnesium unless the blood pressures are severe or you're having symptoms. So they
Yeah.
have to be like 160 over 110 consistently or you're having the bad headaches or things like that in order to
Yeah.
do magnesium. So
And I think they may have been worried that I wouldn't disclose if I had symptoms, but I was like, I'm not going to put me and my baby at like in harm's way. Like if I have symptoms, I'll tell you. But I was like, as of right now, I don't have symptoms. So and it's hard too, where, the practice that I go to and then where I deliver, it might not always be the same doctors that I see in the office.
sure.
So, I feel like there's oftentimes, not a trust there. They don't know me. They don't know what I know, but I also know my body and I know myself. So I think it's hard in that situation too.
Gotcha. Okay. So you said that first doctor was respectful, but the second was how?
So the nurses really kind of stood up for me, and he wanted to, I guess, come in and do a cervical check, and the nurse had told him like, oh, she's Muslim, she would prefer that the OB resident do it. And it was all third year residents that were there. And he was kind of very forceful about being in the room. So the female resident did do my check, but he was kind of like there. And I just felt like his demeanor was kind of aggressive in a way. And I felt like because maybe I had like refused some things along the way or wanted things a certain way, I was almost like kind of being punished for that by him needing to like take control somehow. So that part of it was a little frustrating, but the nurses really, like I remember she did the check and two of the nurses kind of stood on my left side, which was in front of where he was standing. So they kind of put like a wall there, and made sure that I was completely covered with the blankets and stuff so that nothing was visible to him. And it's not that like I would not accept a male provider if it's like an emergency or if, they're the ones that do the C-section, because he did end up being the one that did the C-section. But, if it's necessary, absolutely. But like if there's another option, like that would be preferred.
Sure.
So I felt like there was maybe a little bit of hostility from and that kind of, reflected on, how things were handled.
Right. And how did that make you feel then turning around and this was the person who was doing your surgery?
It was a little difficult. And I guess I kind of felt like I guess I didn't really have a choice. There was two other OB residents that were females that were there. So they were also assistant as well. And then there was a lot of nurses in the room that had been with me throughout the entire experience too. So I kind of just, focused on them pretty much.
Gotcha. Gotcha. And was your husband with you this whole time?
He was, yeah.
Okay. Okay. Do you feel like he was able to help advocate for you at all or not?
A little bit, yes. He also doesn't have a medical background at all. He's an accountant. So we we always joke about that because he definitely is good at standing up for, me and supporting me through all of that. I think it's a little bit harder for him to kind of stand up to medical professionals,
Sure,
which
sure.
I wasn't so much because I am one. So I kind of knew what was appropriate, what wasn't, and I felt comfortable voicing that.
Gotcha, gotcha. That makes sense. That makes sense. So let's talk about for a bit. You said you're Muslim. So what does that mean for you in terms of what you desire for your care, both like during your prenatal care and then during your birth as well?
Yeah. So prenatally, we try to choose female providers just for out of respect for modesty. And it's also usually easier to converse about the female body with somebody who kind of understands that as well. So we try to, for modesty reasons, go with female providers. Obviously, if there's ever like an emergency and there's not a female provider available, we're not going to refuse care. That's often like a misconception, like we would never refuse care. But obviously, you always have like the ideal and then you have the backup. So if the ideal is there and available, that's, what we would prefer. Pregnancy, is something in Islam that's like highly respected. So I do kind of expect that providers, incorporate my religious beliefs into my prenatal care because everything we do in Islam has a purpose and everything is meaningful and it's, all of those things intertwine with each other. Typically prenatally, I am cautious about what I eat to make sure that I'm only eating like halal meat or halal food products. Vitamins were always a struggle. With my third, I think I was finally able to find halal DHA vitamins.
Oh, and what does halal mean? Is that the way it's prepared?
Yeah, so it's the way that the animal is slaughtered and really the way the animal is raised. And it means that the animal is essentially like free range, grass fed, organic. It's treated fairly throughout its life. It's killed in a way that is humane and they're treated humanely throughout their entire lifespan.
Okay.
And then when they are slaughtered, there's a prayer that's said over the meat and it's slaughtered in a specific way that's actually healthier versus ways that kind of stagnate the blood into the animal. So the way it's killed also has to be humane and done in an ethical way. So when we look at like vitamins, a lot of vitamins have gelatin in it, which comes from pork, and pork in Islam is forbidden. Like we don't eat pork at all. So a lot of the vitamins have gelatin, and there are a lot more like halal brands now, but I really couldn't even find that DHA that was halal and had halal gelatin in it until my third pregnancy. So I think for some of them, I didn't take the DHA because I couldn't find one that was halal that I could actually consume.
Right.
So the midwife that I had seen through parts of my pregnancy actually was like really understanding about it and tried to help me find some alternatives. And then I don't even think I really mentioned it to anyone else.
Gotcha. Gotcha. Were you worried if you mentioned it that you would get some sort of pushback or that they wouldn't be open to helping you?
A little bit. I guess I probably kind of felt like maybe they wouldn't understand or I would, like get, like in trouble kind of for
Yeah.
for
Yeah.
not taking it or kind of, like almost be talked down to. So sometimes I just wouldn't even mention it.
Gotcha. Gotcha. Anything else that was different about your care because of your religion?
So typically throughout the delivery process and the labor process, we listen to Quran a lot. So we usually have it playing in the delivery room when the baby's born, and then right after they're born, usually my husband will do it. In one ear, we whisper the Adhan, which is the call to prayer. So we pray 5 times a day, and the Adhan, like if you were in a Muslim country, you'd hear it just from the mosques. They play it really loud. So it's the call to prayer, and we say that in the right ear, and then in the left ear, we say like a shortened version of that, and that's essentially us welcoming the baby into the world as a Muslim. And it's kind of similar to, I guess, like baptism in other religions. Like this is our way to kind of bring them into the Muslim world and, tell them that they're Muslim. So that's something that we do after delivery. And then we constantly have the Quran playing as well. And I think through some of my C-sections, I think one of them they did put the Quran on in the OR. And then the other one, I don't remember why we didn't, but I think one of the other things is that it's kind of like a religious, it has some religious significance, like as the baby's being born, and for them to hear like the words of God as they're being born and all of those
Sure.
things. And there was times like in the OR where there was kind of like some side conversations or like, just it was almost like we weren't there and there was other conversations happening, and then they would stop at, if we asked them to stop. But I think that was something that it was kind of difficult to deal with because it's not always the ideal experience how you would want it, especially when other people maybe don't understand like the importance and the significance of what's happening.
Gotcha. Gotcha. I'm learning something myself right now. So, anything else that's different? And you're not actually asking for a lot. It's not
Yeah.
even like it's like a ton that's super different.
Yeah, yeah. The other thing that we do after the baby's born, it's called tanique, and it's where we take a little bit. So I don't know if you ever had like a medjool date, but those really big juicy ones where you open them up and it's like really kind of like the date you can kind of pick it out. It's very sticky. So we take a little bit of that and it's almost like a puree and we rub it on the lower gum line of the baby in their
Huh.
mouth. And it's actually like a 1500-year-old tradition and it's rooted in when we believe Mary gave birth to Jesus and she gave birth alone under a date tree. And she used the dates to sustain herself and her energy and then also rubbed it on the inside of Jesus's mouth after he was born. So it's something that we do traditionally and we rub it on the inside of the baby's mouth and it's supposed to be the first thing they taste before their mother's milk. So that's something that I didn't really know about that actually when I had my first child and things were so chaotic. I don't even think it ever would have happened. But with my second and my third, I was very firm and like demanding that those things be done. So we were able to do that with our second and then also with our third.
Okay. No, I did not know that either.
Yeah.
Again, learning something new.
I've actually talked to a lot of friends who have had babies and I've told them that I've done that. And they were actually shocked that I did it. And I was like, why? And they were like, well, they're like, we just never asked because we assumed we wouldn't be allowed to.
Mm, gotcha.
So
Gotcha.
yeah, because I've had a lot of other providers say that they never knew about it. And I said, I honestly think people probably just aren't asking because they just
Yeah.
assume they won't be able to.
Okay. Okay. Interesting. Yeah. And I don't think there's no reason why you can't do it. So,
No.
yeah. Wow. Okay. Anything else? I'm like, what else do we need to learn?
Um, so I actually have an interesting story. And actually when my second child was born, because I was pregnant for 41 weeks, he was very large. And he was on the hypoglycemic protocol. It was really hard to get him to wake for feeds. So I used to rub a little bit of the date on the inside of his mouth, like right before every feed, and he would perk up. He would feed great. And then I did that each time and he got off of the blood sugar protocol. His blood sugars were great. One of the nurses even commented, they were like, wow, his sugars are like in the 70s every time. They're like, we usually don't see this. This is really good. He must be feeding really well. And I was like, oh yeah, he is. I never mentioned about this. It was the only way. And it was just, my logic was like, oh, like I know they used to give like sugar water sometimes to like get the babies to wake up and feed. And I was like, maybe this will do the same thing. And it absolutely worked. And then I told a friend about it. And a few months later, she sent me like a research article. I don't think it was done in the US, but it was done, probably in a Muslim country. But it had said that they used like dates to help babies on the hypoglycemic protocol to prevent hypoglycemia. And I was like, wow. So like something I did as like a 1500-year-old tradition was
Yeah.
then shown in like evidence-based research too.
That is really cool. And, I don't think we've appreciated enough of what happens, like taking some of ancient traditions and
Yeah.
carrying them forward. So, and kind of marrying the best of both worlds. So definitely need to do that more.
Yeah, absolutely.
Now, I know you also, just from the picture that you sent, you wear a hijab.
Yeah.
Did you ever experience any difficulties or backlash because of that?
Throughout my birthing experiences, I felt like people were generally respectful. There was a few times, especially with like male doctors, where they were kind of just like knock and barge into the room and I'd be like scrambling to put my scarf on. So there was like multiple times where I know I asked the nurses to like put a sign on the door to please like knock and wait for people to come into the room just so that I could put my scarf on. And I think that sometimes there's this misconception that because they see one part of me, that they have access to all of me. And that's not necessarily okay.
Yeah, it's
You
not
know,
okay, period.
yeah.
Yeah.
So just because, you're able to see one private part of me doesn't mean that, the rest of me is free game either. So I would always, still prefer to like wear the hijab if I was talking to another male or to somebody who's outside of my family. And I feel like most people were respectful and a lot of people did need that reminder on the door, which is fine because it's probably not, it's not the norm for that to happen. So I think it's probably something that, just gets lost. But having the staff put like a sign on the door was really helpful to just alert staff, and then especially when I was up on like the mom baby unit, I just kind of said like no males unless, like they announce before they're coming in. Cause, sometimes you have like the food delivery people bringing stuff in and, it's so many people in and out. So we always just had like check with the nurse. And then, if somebody needed to come in, at least I could like get myself dressed and appropriate before somebody from the opposite sex would walk in.
Gotcha. Okay. Anything else you want to share about your birth experiences and your religion or anything in general?
I think one thing that I always try to tell women is, when you're going through this, like educate yourselves as much as you can and not even just reading online or reading evidence online, but talk to other people. And I think for me, I was the first person out of all of my friends to have kids. So now I feel like I've become an advocate to all of them because they're all having kids now. And I'm like,
Right.
what you need to know. This is what you need to do. So it's like, okay, like, even though parts of my experience were like very traumatic for me, I was like, now I feel like I can help other people, but definitely like talk to other people and, find out what their experiences have been. So that way, when you're going into it, you have more knowledge and you have the ability to really advocate for yourself in those situations. Because I think sometimes, we are like the only advocates we have. And if we're not the ones saying something or standing up for ourselves, there's no guarantee that anyone else will be there to do it either.
That is very, very true and an excellent way for us to end. And I'm curious, do you feel like your experiences have, as I ask, where can people find you with your work? Do you feel like your experiences have influenced your decision to become a lactation consultant?
They absolutely did. I mean, with my first child, I didn't even know what a lactation consultant was. And looking back, I definitely needed one. My first breastfeeding was painful for like the first 3 months. And I came to find when he was 7 years old that he had a tongue tie that was never diagnosed.
Oh my gosh.
Yeah. So, I mean, we breastfed for a year, but it wasn't easy. And had I known about those services, had I known that there was people that could help me, it could have been totally different or a better experience. So that was for me something that I definitely felt like I could relate to more. And I always tell people now, like as soon as they get pregnant, I'm like, prepare yourself for breastfeeding because a lot of people, I think it's just going to happen or it just works. And sometimes that happens, but the majority of the time it usually does not. And there's going to be obstacles. There's going to be questions. And especially in the US, breastfeeding isn't normalized. There's so many people having babies now that don't know anyone that has ever breastfed.
Yeah.
And in a lot of cultures, that used to be generational knowledge. That used to be something that was passed down from grandparents to mothers to granddaughters, and it's not anymore. People are breastfeeding and they have no concept of what that's supposed to look like or what it's supposed to feel like or how it's supposed to work. And we've kind of lost all of those generations of knowledge, and now we're trying to rebuild that. But it's not really at the point yet where it's generational or that knowledge is passed down.
For sure, for sure. So where can people find you to find out more about your lactation consultant work?
Yeah, so my private practice is called Latched Eternal Lactation Consultant. So on Instagram I'm at latched_eternal, and I also have a page on Facebook as well. One of my biggest things that I really advocate for is informed consent. Through my own experiences and also talking to other families, it is never harder when I hear, that parents would have made different decisions had they had that information. They're like, if I had known this 2 years ago, I would have done things differently. And that's heartbreaking to me because the information is there. It's always been there, and it's just that it's hard to access sometimes for a lot of families, or they don't know who to reach out to, or they don't have the support to be able to implement those things. But that's one of the things that I really advocate for, is that parents and families have the information they need to make an informed decision on how to care for themselves and their babies.
Exactly.
And that's the really important part.
Yeah, for sure. For sure. Well, Jennifer, thank you so much for agreeing to come onto the podcast. This has been a really helpful and informative interview, and I really appreciate you coming on to share your story.
Absolutely. Thank you so much for having me.
Okay, don't you agree that that was such great information and really informative? I really enjoyed talking to Jennifer, and I really appreciate her sharing her story. Now, after every episode when I have a guest on, I do something called Nicole's Notes, where I do my top 3 or 4 takeaways from my discussion with the guest. And here are Nicole's notes from my discussion with Jennifer. And actually, it was hard for me to narrow it down to just 4. Okay, number 1, practice patterns can differ so drastically from place to place, or even between doctor to doctor within the same practice. Jennifer mentioned that for her second birth in 2013, she knew that labor induction in the setting of a trial of labor after cesarean was possible because she'd seen it done in other places. And she is exactly right. You can definitely be induced for a trial of labor after cesarean. In her case, she unfortunately cannot find other options because she was constrained by insurance, but many times you can. So I say that to say that if you have a provider who's telling you things that aren't possible, and you either suspect they are possible or you know for sure that it's not true, if you can, then find other options. Look for another provider. It is never too late to change, to find someone who is more supportive of your wishes. Okay, point number 2, nurses can save the day. Let me tell you, a good L&D nurse is so important. They're the ones who are with you at the bedside for the vast majority of your labor, and they can make such a big difference in your care. It was a nurse for Jennifer who asked, "Why are the things that you want important to you?" And she listened to her, and she went that extra mile in order to help Jennifer have the experience she wanted. And in the case of Jennifer, she actually helped buffer against some of the negative care that she was receiving from the male care provider, who was more kind of aggressive about wanting to be in the room when she was being checked and not being respective of her preferences or wishes. It was nurses who helped advocate for her. So a great nurse for your labor and birth can make all the difference. This is another area where if you are not happy with the nurse that you have, then ask for another nurse. You can ask to be assigned a different nurse. Just ask to speak to the charge nurse. The charge nurse is the nurse who is in charge for the shift, and she does not have any patient care responsibilities typically, or they're very small patient care responsibilities. And she is the one who can give you another nurse if you're not happy with the one that you have. So nurses can save the day. If you're not happy with the one you have, then ask for a different one. The third point I want to make is that doctors can change. Our system can change. Jennifer delivered with the same practice for all 3 births. And by the 3rd one, they'd finally come around. However, as you can see, change can be slow. It can take on average many years for change to occur in medicine. Actually, Jennifer knew about delayed cord clamping and skin to skin before the doctors in her practice did. But I do want to mention that there is hope that our system can change. So all is not lost in terms of having that birth experience that you deserve. It really is possible. And then my final point, and something that Jennifer said that I want to echo, is to educate yourself. Of course, information alone doesn't necessarily fix everything. In Jennifer's case, she had information, but she still faced some challenges. However, without without information, without that education, without that knowledge, you're really leaving yourself completely at the mercy of those around you, and you may not have what you need in order to advocate for yourself. This is where great childbirth education is so important. Really, everyone should invest in great childbirth education. It's key. And speaking of childbirth education, do not forget to go follow me on Instagram at Dr. Nicole Rankin so you don't miss the special announcement that I have about my online childbirth education class, the Birth Preparation Course. All right, so that is it for this episode of the podcast. Be sure to subscribe to the podcast in Apple Podcasts, Spotify, Google Play, wherever you are listening to me today. And I would really love it if you leave a review in Apple Podcast. First of all, I love hearing what you think about the show. All of those comments helps keep me going, helps keep me motivated. It gives me ideas for things to talk about on the show. It also helps the show to grow and helps other women find the show. So if you can leave me that review, honest review in Apple Podcasts, I would so appreciate it. Now, next week on the podcast, I have a guest on who will be sharing her very interesting fertility journey and how she took a bit of a different approach to it. So do come on back next week. And until then, I wish you a beautiful pregnancy and birth. Thanks so much for listening to this episode of the All About Pregnancy and Birth podcast. Head to my website, ncrcoaching.com, to get even more great info, including free downloadable resources on how to manage pain in labor and warning signs to look out for after birth. You'll also find information on my free online class on how to make a birth plan, as well as everything you need to know about the birth preparation course. Again, that's ncrcoaching.com, and I will see you next week.